tube stuff. So this is a very muscular patient. He is 50 and he is very muscular, pretty thin fat pad on the subcutaneous tissue and a lot of muscle, and he bikes. So let's look for emphysema. No emphysema, but there is quite some edema of the superficial tissue. So there is a tiny effusion, pleural effusion on the right. He has gone through bariatric surgery right there. Bariatric surgery, gastric bypass. They scanned the abdomen. Go figure why, but no, they didn't do contrast enhancement, of course, because why? Why help the radiologist if you can just make my life shittier? Just leave me to guess, because I'm a guesser. My profession is guessworking on scans. That's what I do. I take educated guesses. So there really isn't much of an effusion, a pleural effusion, just a pleural thickening on the right base of the chest, and maybe, just maybe, a bit of the same on the left, right there, maybe, might be. The lung parenchyma seems fine, seems okie dokie, tiny laminar atelectasis on the base on the right. So okie dokie, no major lung contusion, no major consolidation, no signs of ground glass opacities. I know, I'm going to look for fractures. Settle down. It's going to be just now. I'm just going through the easy stuff first, so we can put that aside and look for fractures. This is calcifications on the aorta, calcification on the coronary. The heart is normally sized. The esophagus doesn't seem to be thickened. There aren't enlarged lymph nodes anywhere I can tell, nor masses. Thyroid seems small. Now I'm going to do a MPR, because MPRs are needed for bone, as you guys know. So bone needs MPR. So there is spondyloarthrosis of the dorsal spine, and we are going to look for fractures, and we are going to look at this side first. Let's just put it here. I'm going to grab a sagittal for later, and here we are. Right side from the 12 rib upwards. Let's see if we can see any fracture. Are there any fractures? Did you see fractures? I didn't see fractures yet. No fractures. No fractures, just arthrosis. Nah, no fractures. Let's look at the anterior. Oh, right there. Fracture. Yes, there is a fracture. Usually it isn't just one. Usually it's more than one. So one fracture. In this case, there is just one fracture. So let's see if there are spinal fractures. There could be transverse process fractures, or spinal process fractures. This is not a fracture. Transverse process fractures. No fractures. Nah. No fractures. No. Agora we have to know which rib is that. So this is 1, this is 2, and 3, and 4, and 5, 5. So the fifth rib on the right is fractured, and the thickening of the pleural leaflets on the same side. So let's just, because we have to, let's look for fractures on the left. It says the patient had a trauma on the right side, so we're not supposed to find fractures on the left, but it won't be the first time they got it wrong, and he has fractures on both sides of his chest. Not this case. There is no fracture here. Yep. Let's just confirm that fracture on the sagittal view. So you guys look for yourselves and just don't trust me. See? Spondyloarthrosis. Is the sternum fractured? No. Is the right collarbone clavicle fractures? I couldn't be sure because it wasn't imaged completely, but the part we can see isn't fractured. Let's see if they're all right there. This is an acute fracture right there. So indeed, 5, 4, 3, 2, and 1. So it's the fifth rib indeed. Fifth rib on the right is fractured. So let's report it and be on our way. Just spondylosis, spondyloarthrosis of the dorsal spine. I'm sorry. As I said at the beginning of the stream, I have had my throat crushed by BJJ graduates, BJJ collar belts, as they say. They were mean to me. They tried to rip my head off my neck, and they almost did it. It was fun. I'm going to try it out today yet another time, because I want to rip people's heads off their necks in a figure of speech way, of course. Jiu-jitsu is fun. So just atelectasis, a tiny laminar atelectasis on the base of the right lung,